just going to get started now. We'll have about 20 minutes for this webinar. My name is Molly. I'm the marketing manager at Rock Health, and we're going to talk about the Q1 digital health funding update. I'm joined today by Teresa Wang, our strategy manager, who put together this report, and Stephanie Liu, our strategy fellow. We'll save a few minutes at the end for Q&A, so please feel free to type in questions on the left side dialog bar, or you can also upvote questions you would like to see answered. I'll hand it over to Teresa, who will take you through the webinar.
Thanks, Molly. Before we start, I wanted to take a minute to define what Rock Health considers to be digital health. We view digital health as the intersection of healthcare and technology. This means that the venture funding track only includes technology-centric, health-related companies, whether they focus on the administration of healthcare, the delivery of healthcare, or the process of bringing breakthrough new healthcare products to market, both on the R&D and commercialization side. Additionally, Rock Health funding data only includes disclosed US deals over $2 million. Deals under $2 million would be nearly impossible to track comprehensively, since companies often do not file their small seed rounds with SEC or disclose this to press. We also believe that deals under $2 million generate noise in key statistics, including the deal count and average deal size. As most of you probably know, 2014 was a record year. Digital health companies raised over $4 billion in venture funding, which represented 125% year-over-year growth. This unprecedented growth has led to a lot of speculation around whether or not this growth would be sustainable. While many observers may be ready to say that 2015 will be a slower year, we believe it is still too early to tell. Q1 2015 saw over $630 million in funding, which represents an 80% trailing 12-month year-over-year growth. The absolute amount in funding was about $100 million below Q1 2014, though it's worth noting that there was the same number of deals done, and though the average deal size has returned to the historic mean of $10 million. Also, with $630 million raised in this past quarter, it still is 15% more than the average of the past 16 quarters. Ultimately, we decided to use this trailing 12-month metric as our core measure of growth to smooth out quarter-to-quarter variations. It's important to remember that venture is a hits business, driven by big deals and big exits that can happen and fall in one quarter versus another, creating significant variability when comparing across quarters. We know that there are large rounds that have been completed and are yet to be announced, as well as some name brand companies out raising large rounds right now that could create a large spike in the following quarters of 2015. The top 6 categories for digital health accounted for 61% of funding this past quarter, with healthcare costs expected to rise 4.9% next year and federal initiatives seeking to further reduce costs and streamline processes. It's no surprise that analytics, big data, digital medical devices, and population health management reappeared at the top. And as healthcare reform continues to fuel the shift towards healthcare consumerism, we see healthcare consumer engagement consistently as one of the most funded categories. As individuals begin bearing the cost burden of healthcare expenses, there has been a significant change in purchasing behavior. There is a new patient archetype or consumer that not only is more price sensitive, but is also expecting a more pleasant experience and interaction with healthcare. Over 50% of individuals who purchased insurance on healthcare.gov this past year had quote-unquote shopped around before purchasing their health insurance plan. One of our portfolio companies, Stride Health, which raised a $2.5 million seed deal back in January, is a great example of a healthcare consumer engagement company meeting the needs of consumers. Stride Health is an online health insurance recommendation engine that allows you to build a personal health forecast, pick a plan, and get your government subsidy on your smartphone in less than 10 minutes. The traditional healthcare, whether that's the payers or providers or even biopharma, are struggling to figure out how to successfully build relationships with the patient and capture that transactional value. Meanwhile, new entrants like Stride or Oscar and Collective Health are moving to take advantage and shift the basis of competition towards service and experience, moving away from the traditional price-driven purchasing. Additionally, this quarter, digital diagnostics and EHR clinical workflow tools both re-entered the top 6. Clinical workflow solutions saw nearly $63 million in funding, reflecting the continued need for streamlined efficiencies that not only help improve care, but are also physician-centric. Most of the top 6 categories were heavily influenced by a single large deal. 5 of the 6 were influenced by the largest deals of the quarter, which totaled $240 million. Remember when I said venture is a hits business? That's nearly 40% of all funding accounted by the 6 largest deals. Collective Health, a payer administration tool, and a Rock Health portfolio company, was the only top 6 deal not corresponding to top 6 category this year. However, we remain excited about the growth of payer administration solutions, especially since it experienced nearly 270% growth last year. There's 2 reasons we expect continued growth in this space. First, under the MLR caps, payers are facing increasing pressure to improve efficiencies and reduce costs in order to improve margins. They need digital health solutions that can help them trim the fat. Secondly, employers want to control their healthcare expenses. Over half of Americans receive employer-sponsored insurance, but only a third receive coverage from self-insured employers. Currently, over 2/3 of medical expenses are paid for by the employers, and these healthcare expenses have grown by 14.5% over the past 6 years. This presents an opportunity to help current and future self-insured employers better manage their employee healthcare costs. Deal distribution this past quarter remained consistent with what we saw in 2014. 60% of volume was seed and Series A rounds. There was a slight increase in the number of Series B deals from 18% up to 21% this year. Additionally, 8 out of 12 of these Series B companies had previously raised in the past 2 years. This past quarter, we saw quite a few new venture investors emerge at the top as most active. HLM, NEA, DCM, Easton Capital, RRE, Lux Capital, Thrive Capital, and Sands Capital each closed 2 deals this past quarter. None of these venture investors made the list for most active in 2014, though it is worth noting that several of the prominent digital health investors such as Kleiner and Sequoia have announced a deal this quarter. There was less variation by the corporate investors, with Qualcomm, Merck Global Health Innovation Fund, Google Ventures, and Cambia remaining active. However, the most active corporate VC this quarter was actually GE Ventures, one of Rock Health's partners, with an astounding 4 deals. CHV Capital, aligned with Indiana University Health, and Kaiser Permanente Ventures, a Rock Health LP, both announced 2 deals as well. Now, Stephanie will walk us through some of the M&A highlights.
Thanks, Teresa. So on the M&A front, it was a record quarter for M&A activity, with 41 deals announced, nearly half the deals we tracked in 2014, which had 95 M&A deals total. We had 14 acquisitions, which had a disclosed aggregate value of over $1.6 billion this quarter. Digital health companies were the leading acquirers, with 19 deals that ranged from EHR and clinical workflow to clinical trial management. As you can see on the slide, med device payer, biopharma, and providers did not have any disclosed acquisition prices, although we would not be surprised if medical device companies like Nantis Medical, which made 2 acquisitions this quarter, paid a healthy amount for its acquisitions, given that historically medical devices have had high acquisition value per disclosed deal compared to other acquirer categories. So I'm just going to highlight some of the notable acquisitions for quarter 1 of 2015. The first being Under Armour's acquisition of MyFitnessPal for $475 million, which was the largest disclosed deal of this quarter. At the time of acquisition, MyFitnessPal reported to have 80 million registered users, which Under Armour will likely leverage to develop stronger relationships, improve brand loyalty with their customers, encourage healthier, active lifestyles, and sell more apparel and footwear products with this acquisition. The all-cash exit was a great outcome for the brothers, Mike and Albert Lee, who had founded the company in 2005 and bootstrapped the company to 40 million users until they raised 18 million from Kleiner Perkins and Excel in 2013, which was quite an amazing feat. The second acquisition we wanted to highlight was Athena's acquisition of Razor Insights and Web OMR, signifying its strategic entry into the hospital EHR market. So Athena's Health's first acquisition of the year was Razor Insights, which is a cloud-based EHR and financial solutions for rural critical access and community hospitals, followed by Web OMR, which is a web-based clinical application and EHR developed by Beth Israel Deaconess Healthcare, which is one of Harvard's medical hospitals. So the plan for Athena is to emulate WebOMR's EHR infrastructure into Razor Insight software, creating a comprehensive hospital EHR platform. As CEO Jonathan Push stated in the latest announcement, these two acquisitions are Athenahealth's, quote, single biggest step function shift upwards towards our vision of a healthcare internet in our 17 years of trying that I can point to. So naturally, Athenahealth and its management team has made a lasting commitment to innovative disruption within healthcare, and we're likely to see more more innovation on their end. Bush's latest book, Where Does It Hurt?, argues for many unconventional, albeit innovative approaches to fix healthcare. If anyone's read it, one of his seminal ideas include transforming healthcare into a shopping revolution, which will remove safety nets and create an open, competitive, flourishing marketplace, which could enable patients as the customers to have more access to accessible and affordable healthcare. And one of the most memorable quotes from Bush in that was, run healthcare like a business and treat patients like customers. Another health tech acquisition this quarter was Fitbit's acquisition of Fitstar for at least $17.8 million based on their latest SEC filings. So Fitstar has two fitness coaching apps, which collectively had more than 3 million downloads after Apple had heavily featured the company for months following the launch. Fitstar had raised $5 million in 2 rounds of financing from leading consumer internet investors, including Floodgate. And entering the fitness coaching space seems to be quite a natural expansion for Fitbit. Not only do both of these companies have overlapping target demographics, but the acquisition will also help Fitbit offer differentiated software to complement its portfolio of biosensing wearables. The next acquisition we would like to highlight was Catamaran's acquisition of Healthcare Solutions for $405 million. And as you guys might also know, United Healthcare also announced its acquisition of Catamaran for $12.8 billion, which I think, again, highlights the excitement in the health plan space and in general in the healthcare space to provide digital solutions for their customers. So Catamaran's acquisition will likely boost Catamaran's presence in the workers' compensation market, which is the core competency for healthcare solutions. And Catamaran, being a leading provider of pharmacy benefit management, is expected to realize about $10 million in synergies with this acquisition. PBMs, or pharmacy benefit managements, continue to be a growing stakeholder in the healthcare landscape, with PBM revenue growing by nearly 27% this past year. And then subsequently, United Healthcare's move to buy Catamaran will likely help both parties negotiate better deals from pharma companies, with hopefully the end result being lower drug prices for patients. And I think this move also echoes Rite Aid's purchase of PBM and Vision Pharma for $2 billion last year, as health plans like Rite Aid and United Health want to make an entry into the PBM market. And also, just as a note, if anyone has seen the latest news today, a Catamaran investor is actually suing Catamaran for negligence in negotiating a maximum sell price of the company to United Health Group. So more to come on the status of that acquisition. The next acquisition we wanted to highlight was medical device company Nantis Medical, which has made 2 acquisitions this quarter. One, Global Neurodiagnostics, as well as Healthcare Observation Systems, which I think demonstrates a continual push for Natus Medical to build out its neurodiagnostics business, especially in the pediatric space. If some of you might remember, in 2012, Natus Medical had bought the neurodiagnostics business from CareFusion for $58 million. So I think these 2 acquisitions will likely expand Natus Medical's digital health offerings for its products. Both Global Neurodiagnostics provides telehealth EEG diagnostic services, and Healthcare Observation Systems, a camera mobile technology company, has a main product called NICView, which provides a comprehensive service program for real-time viewing of babies in the neonatal intensive care unit by their families. Lastly, Roper Industries, which is a diversified technology company, as well as its subsidiaries SunQuest Information Systems and Managed Healthcare Associates, MHA, have made 3 acquisitions total as the company looks to enhance its healthcare analytics services. The parent company, Roper Industries, has 4 main lines of business that span across a number of different non-healthcare industries, such as industrial technology, radio frequency, imaging, and energy. And they actually acquired Strata Decision Technologies, which powers SaaS solutions for financial and business analytics support in healthcare. In 2012, Roper actually acquired SunQuest Information Systems, which is a diagnostic and laboratory information service, which along with MHA, a healthcare service and technology subsidiary of Roper, made a combined $450 million acquisition of 2 data analytics company, the first being Data Innovations, which provides lab data management solutions, and SoftWriters, which provides pharmacy software solutions. So in conclusion, I think it's interesting to note how acquisitive a number of these non-healthcare companies have been this quarter, such as Under Armour and Roper Industries. And we look forward to seeing, with an increase of extra opportunities in the future, continued strong investor interest in the digital health space, as it looks like everyone wants to get a piece of the digital health market. With that, I'm going to turn it over back to Teresa.
Thank you guys for joining us for our Q1 2015 funding update on digital health. If you have no questions right now and they come up later, feel free to email us at research@rockhealth.org, and we'll be happy to keep the conversation going there. Thanks so much.